All right, welcome back to our next week of Science for Healthcare Workers. We've been looking at all of those tasks and skills that you need to know being a CNA. And so I want to practice our conversions one more time. And so remind me, how many ounces are in 1 cup?
8.
8 ounces, very good. How many cups are in a pint?
2.
2 cups. How many pints are in a quart?
2.
2. And then how many quarts are in a gallon?
4.
4. So it's the 8224. So 8 ounces, 2, 2, and 4. All right. So here's our new math problem for today. You bring breakfast, maybe brunch, breakfast or lunch, to a patient. They're on a liquid diet, so everything has to be liquids only. We have 8 ounces of orange juice. We have a cup of Jello, 2 cups of chicken noodle soup, 1 cup of tea, 8 ounces of water, and half a cup of chocolate pudding. How many? Let's do ounces, because that's our lowest unit of measurement. How many ounces altogether did they consume? Go ahead and solve that. I'll give you a few moments. Use a calculator if you need to. Go ahead and let me know when you're finished.
I'm
Finished. How you doing, Maurice? All right, ladies, what did you get?
I got 52.
How many ounces?
I got 52.
52?
I got 51.5.
51.5.
I got 52.
52. Maurice, did you get 52 too? 51.
Wait, no, I got 52.
You got 52. I also got 52 too.
Yeah.
All right.
Yes,
So,
Don. Yes.
so how did we get 52? How did we do it? Who wants to walk us through how they did it?
Just 8 ounces for every cup.
Yep. So we had 8 ounces. The cup was an 8 ounce. How many ounces would be 2 cups of chicken noodle?
16.
16. Yep. Which is 8 and 8. Yep. And then cup is 8. 8 ounces is 8. And then half a cup.
4.
4. Yep. Very good. And then we added them all together. Or did you use multiplication? So in my mind, how I did it was I saw that there were 6 8s, right? We have an 8, an 8, 8, 8, 8, and 8, right? That there's 6 of them. So I already know 6 times 8 is 48. And then I added 4 more, which is 52. That's how my brain did it. All right, so we know we have 52 ounces. Now we have to convert it to milliliters. Go ahead and try it on your own. Tell me how many milliliters is 52 ounces. Remember, you can use an online converter or you can do cross multiplication. I'll give you a minute. Go ahead and give me a thumbs up when you're ready.
I got mine.
All right, good job, Maurice. Who else? Let me know when you're ready.
Fine.
I can't do this in my head. I actually have to get out a calculator. All right. How are we doing, Christina? Eva? Good or still calculating?
I think I got it.
Think you got it? Okay.
Same.
Same. All right. What did you get, ladies? How many milliliters?
1,537.64.
Say that one more time.
1,537.64.
37.64. Interesting.
I
Okay. Yep.
0.8.
1,537.82.
0.82. Okay. And I think a lot of it determines what number you use here. So I actually cut it off at 0.5. So when I did it, I did 29.5. What number did you do the whole number?
I did 29.57.
I did the whole number.
You did the whole number, yeah. And that'll give us those little bits of variation. But again, 1,537, yep.
If you do 59 times 29.5, it's just 1,534.
Yeah, and that's what I got too, 1,534. So yeah, 34, 37, we're right in that same ballpark. We did it right. Now, how did we know we needed to do multiplication? If we were to do cross multiplying, how would I write my two fractions? So I have 52 ounces, and I'm trying to figure out how many milliliters that is. What do I write here on the other side? What's my top number and what's my bottom number?
The bottom one is milliliter and the
Yep.
top one is 1.
Yep, so I have 1 ounce is how many milliliters?
So it's 29.5.
29.5, yep.
29.5.
And that's how I set up my fraction. And the rule that I remember is that I keep the same units. So if I have ounces on top, I need to write ounces on top for my fraction, for my ratio. And then if I have milliliters on the bottom, I am going to have milliliters on the bottom for my ratio. And now that I have them set up, I know I can cross multiply. So I multiply and then divide by that third number. So 52 times 29.5 divided by 1 will give us those number of milliliters, 1,530 something, 34, 36, somewhere around there. And that's milliliters. How many liters is that? Let's remember. So there's always 100 milliliters in 1 liter. So I have 2 decimals, actually 3 because of 100. So I'm going to go 1, 2, 3. It's because it's 1,000, not 100. 1,000 milliliters is in 1 liter. And because I remember that because 750 milliliters is like a large bottle in the grocery store. So 1.5 liters. All right. How is that, ladies? Any questions about those conversions? Are we getting it? Is there something you're not getting, or are you feeling pretty good about it?
I feel
Feeling pretty good.
about it.
How are you feeling about it, Libby? Good?
Yep, I feel
Okay.
good.
Feel good?
I need to use it consistently to have it stay in my head.
Yeah, absolutely. And that's why I keep bringing one up at the beginning of each class. All right. Any other questions, ladies, about this? Are we feeling good? Because I can go over it again, or I could also meet with you one-on-one. So if there's something where you're just like, I'm just not getting this, let me know. And I can always just schedule a time at another time to meet with you one-on-one and try to talk to you and maybe show you a different way to look at it and maybe understand. Same thing with like the clocks and the scales. If you did the scale assignment and you were just like, I still don't get this, let me know, and I can meet with you one-on-one and we can talk about what we need to do. But we're going to move on. And our topic today is we were talking about the CNA skills test. Have you heard about this, ladies? Do you know what this is?
I feel like I've heard snippets about it, but not much.
this is the actual practical test that you have to do hands-on in person to get your CNA certificate. And there are all of these tasks that you have to do, or these skills, and you have to have them memorized. You have to know what is step 1, what is step 2, what is step 3, what is step 4, and follow them in the correct order. And I think it's like a 70 or 80% accuracy that you have to get to then pass to get your certificate. And there is, I think here in Alaska, they only have 25, but there are a total of 30 skills, but I think in Alaska, they only test you over 25 of them. But there are 30 skills that are these like list of steps, these procedures that you have to do. Let's read through them. First 5. I think number 1 makes sense, hand washing. We understand that, but there is procedures. What do you do first? What do you do second? What do you do third? And you have to follow all of those procedures. There's also things that you can't do that you may not realize. Like, for example, when washing hands, one of the things you can't do is touch the inside of the sink while washing hands. You have to keep your hands up away so it's not actually touching the sink. Another thing you can't do is when you're done washing your hands, when you're ready to move on to drying, you can't go like this. Like, because we all want to do that, right? Can't do it. That's not on the steps. You have to follow the steps precisely. And so this is probably the most challenging aspect of the CNA training, is preparing for this examination that you'll have to do in person. And the instructor will not test you over all of them. I think Benito does like 5 of them, but you don't know which 5. So you show up the day of the test, you need to have all of them prepared and ready to say, all right, if she asks me to show catheter care, I know all of the steps for it. If she asks me to do mouth care to a patient, I can do all of the steps to it. And you have to be mentally prepared to show any of these during that test. All right, so we have hand washing, indirect care. Measuring blood pressure. We know what that looks like. We kind of looked at it before, where they have the blood pressure cuff and that whole process of how to do it. Measuring body temperature using the little machine to take a person's temperature. Recording a pulse is something that we've practiced, but we haven't actually done the steps. Measuring and recording respiration. So again, how are they breathing, and recording and measuring it. Measuring output from a urinary bag. All right, ambulation is going to be a new word. When you hear the word ambulation, that has to do with the idea of moving, whether a patient is able to move themselves or not. If a patient is ambulant, that means they can physically move themselves. They can get up, they can walk. They might just need some assistance kind of getting up and getting down, and you're there to kind of help them. A gait belt is a tool that they kind of wrap around a patient to help guide them when moving. Maurice, do you do any of this in your job working at the senior center?
Yeah, we have gait belts.
You have a gait belt. And so
Yeah.
Maurice would actually probably know so much more about this than I. I've never used one. I just know about it. Feeding. There is a process of like, how do you approach the patient? How do you introduce your patient? How you wash your hands beforehand? There are all these steps that you have to do for the feeding process. Mouth care. Mouth care if they have dentures. Mouth care for an unconscious patient. So maybe they're in a coma, or they're for some reason they are not awake, they're unconscious, but we still have to take care of them. How do you provide that mouth care for an unconscious patient? Toileting with a bedpan. Do we know what that is? A bedpan?
Yes,
Yep,
I've done
it's
that before.
Yeah, so they may not physically be able to get up and go to the bathroom, so you actually give them a bedpan so that they can like urinate while sitting there in the bed.
Mhm.
Hand and nail care, foot care, transferring from the bed to a wheelchair. Changing positions in bed, how to roll them, especially if they're unconscious or in a coma, so they're not getting bed sores. Can we change their position? Changing an occupied bed. This here is changing the bed sheets. So if there's a person in the bed itself, how do you actually change the bed sheets without them actually physically getting up out of the bed? There is a way to do it. Parental care for females. I am not sure what this actually stands for, parental care. I feel it has to do with, since there's male, female, it has to do with something that's like urination or sexual. Parenal.
Yeah, you're cleaning their genital area.
Yep,
for
yep.
female care.
Yep, that's what I thought it was. Yep. So cleaning their genital areas for males and females. Catheter care. This might be a new word for people. Do we know what a catheter is?
I know what it is, but I don't know how to explain it.
It helps you with urinating if you can't go on your own.
Yes, exactly. If you can't physically go on your own, or if you don't have control of your urination, they can put in a catheter, which is like a tube that goes down the urethra into the bladder, and then it allows the bladder to naturally discharge into a bag, into a sac. All right, partial bed bath. So this idea of like bathing a patient while they're still in the bed. So you're only going to bathe part of the patient.
Yeah.
Dressing a resident with a weak arm. So getting clothing on, helping them put on clothing if maybe an arm is broken or they're in a cast. How do we actually clothe them and help them with that? Applying elastic support stockings. Also, something that's really common among elderly care are putting these stockings, which are like types of socks, especially if there's like circulation issues or
I think we call
diabetes.
that compression socks.
Oh, say that again, Maurice.
I think we call this elastic support stockings like compression socks.
Compression socks. Yep, absolutely. Yeah. That's a name that I've heard from too. Compression socks. Yep. So body positions, this is actually physically moving them. And so let's look at these words here. Supine, prone, and lateral. Prone is going to be on their stomach. I'm pretty sure, or it's, let me double check this. Yeah, prone position is on their stomach. Here's an image here. So we have prone is getting the patient rolled over on their stomach. Lateral is on their side, and then you can choose, is it the left lateral or the right lateral? Like what side of their body is actually touching the bed. So this one here is a right lateral because the right side is on the bed. Left lateral, the left side is laying down, sitting position, and then the supine is face up. All right. Any questions about those? So the actual skills of moving them. Sims and Fowers are also other positions here. Let me find a picture here. So this is the Fowler's position that we see here. So how do we get them in that kind of like sitting upright position? And the Sims position, let me find a picture of that. is here. Patient on the left side, left knee slightly tilted, right knee bent. The Sims position. All right, so all of these here, 25, 26, and 27, is all about body position, of rotating the patient, moving them, getting them into those different positions, and what are your steps and procedures that you have to do that. And what I mean by steps and procedures is like step 1, knocking on the door before entering. 2, introducing yourself. Hi, my name is Sean Story. I'm your CNA today, and I'm going to be helping you do blah, blah, blah. Those are all of the procedures that you have to do. Washing your hands is normally like step 1. You introduce yourself and then you wash your hands. And then the next 3 are about range of motion, which is helping them move their body, exercising and moving their shoulders, their elbow and wrist, their hip, knee, and ankle. All right, so like I said, this is the hardest part about the skills test. Now, why? Why do we have the skills test? These are the reasons why. It really helps us understand the importance of verbal and nonverbal communication, right? That as CNAs, how are you communicating with the patients? How are you introducing yourselves? How are you providing the best care possible with being aware of the words you're saying and also what you're not saying with your body? Understanding the rights of patients, you know, that the steps and procedures are in there to protect you, but also to protect the patients too, to make sure that there is this standard, that all of the care is standard, everyone's receiving the same type of standard, and that is all set into place. That you as a CNA know your responsibility towards the patient, right? That by following the steps and procedures, you know you're treating the patient with the best care possible and treating them with equity and equality. Knowing personal and patient safety, like why we wash our hands every time before working with a patient. And then the main reason too is also this idea of cleanliness, so that we're not contracting diseases. And we're very aware of this, especially during the last pandemic, of how are we using PPE? How are we protecting our patients from contagious diseases? All right, any questions on this, on why we have the CNA skills test before you can get certified? Does that make sense?
Yes.
All right, so here are my study tips for you to help you prepare for the CNA skills test, which a lot of people say is the hardest part about getting that CNA certificate. Are you ready? Ready for my study tips?
Yes.
First
Ready.
study tip that I say is prepare from day 1. From the first day you start CNA training, really get in your mind, these are the skills that I need to know, that I need to be able to demonstrate, and I need to know all 10, 13, 14 steps and know them in order and be able to physically, not only just say them, but physically do them. And to show the instructor, I know the steps, I can tell you what the steps are, and I can physically demonstrate them and show them and then use them on a patient. And start from the very beginning. The worst thing you can do is say, oh, I'll just study at the end of the class. No, no, no. Really start studying. Take 2 or 3 of these and say, all right, for this week, I'm really going to practice on just 3 and do them over and over and over again. And then the next week, I'm going to do these 3. And then the next week, I'm going to do these 3. And by the end of the semester, you have gone through and you have now practiced all of them and you're ready to go, and you've recycled, you've revisited, and you're starting to practice from the day 1. From day 1, be asking Benita about the skills test and say, hey, how can we prepare? What do you want us to do? Because she's the one that's going to be testing you. Something else to keep in mind about this idea of preparing, know that Benita wants you to pass the skills test, right? It's not like they're trying to trick you. It's not like they're trying to make you fail. Her job is to prepare you for success. So the more you can ask questions, the more you can show her, hey, is this right? Is this how you would do it? Because she's the one that's going to be grading you. So, all right, step number 2, create a study plan. So with that idea from day 1, know when you're going to study, how often you're going to study, and what you're going to study, and create that plan, because you really just have that one semester to take all of the classes, do all of the homework, learn all of the anatomy, learn all the vocabulary, learn all of those acronyms that we've been practicing, and then also perform all of these skills tests. So no, when are you going to study? Are you going to study every Saturday morning? Are you going to study every Sunday night? Are you going to study Tuesdays and Thursdays? When are you going to study and create that plan? Also, remember my tips to studying is you want to do shorter amount of time more frequently. If you could set a 20-minute block every single day to study just a short amount of time, that would be better than say, well, I study every Saturday for 2.5 hours. It would be better to study every day for 20 minutes than to study once a day for 2.5 hours. So create that plan, write it down, and stick to it, because that will lead to success. Next one is use your resources, right? Use the manual that you're going to be giving, use the books, use your classmates, have them help you, have them practice. Let you practice on them and say, hey, can I practice? You're going to be the patient and do role play. Say, hey, I'm going to treat you like the patient, and I'm going to come in and do all the steps and then get feedback from your classmate. Ask your classmate if you did it right. She's like, did I forget one of the steps? Which one did I forget? And then switch. You be the patient and you watch your classmate do it. Because again, that really helps solidify that information, because in your mind, you're going, all right, there was step 1, there was step 2, there was step 3. Oh, she skipped number 4. That wasn't quite right. And that's going to solidify your knowledge and understanding of it too. So use all of the resources that you have available, specifically the instructor. Like I said, she's there to help you pass. They're not trying to trick you. They're not trying to say, oh, you failed, no more. The success rate is really high. I mean, I think last year, 100% of the CNAs all passed, right? That they want you to pass. All of the resources and opportunities are there, but you have to do it. So use all of those resources. Another one is get that certified handbook as soon as possible. When you start the CNA program, ask Benita saying, hey, where do we find the skills test? What is the handbook that you use? What are the specific procedures? What's the language you want us to use? Get that handbook and start going through it. And like I said, make that study plan, do 2 or 3 every week and practice them over and over again, and then move on and cycle through all of them. So you don't feel at the end of the year, you're just cramming to get all of them in 1 week, because it's too much information. The more you practice, the better you'll do. So get a copy of that handbook. Another one is don't miss class. I don't know what Benita's attendance policy is, but I know you are allowed to miss a certain number of classes, because, you know, life happens. We're adults, emergencies happen, you know, we get sick, family gets sick, but every time you miss class, you've missed information, because the CNA class is very short. There's a lot of information. And so every day is new stuff. Every class that you've missed, you have missed something. You have missed a step, you have missed a procedure, you have missed something, and you need to make that up. So try to avoid missing class above everything. If you do have to miss a class, really talk to your classmates, talk to your peers, get notes, talk to the instructor and say like, hey, what can I do to make up that information? Because that every class is new information. There's not a lot of repeat and repetition like I do. So it's often one and done. This is the class, this is what we're talking about. I told it to you, we're now moving on. So if you miss that class, you missed all of that information. Now, when actually taking the test itself, it's very important, remember, not to panic, right? Take deep breaths, don't panic, it will be okay. Just like I said, we had 100% success rate of graduation for last year. Your instructor wants you to pass. Everyone wants you to pass. It will be okay. If you fail, you'll just have to take it again. But you're not going to fail, because you ladies have had a head start. You've worked with me. You're starting from day one. You're not going to pass. You're not going to fail, right? Right.
Right. Hopefully.
Yes, right.
Yes,
Yes.
absolutely. So don't panic, you know, just relax. And that's my next step, right? I have one that just says, relax, right? Relax, clear your mind, because when you are stressed and you have anxiety, that actually affects your neural processing, right? You may know something, but if you have a lot of stress and anxiety, your brain won't make that connection and you won't remember it, right? The best thing you can do is relax, have a nice relaxing cup of coffee or tea, listen to some music, do some meditation, do whatever you do, exercise, whatever makes you that relaxed, happy state, the best you can do. That concept is called the affective filter. The more anxiety and stress you have, the less your brain is aware of its surroundings. The less your brain can think and process what you're being asked, what you need to do, and remember all of that information. So relax before the exam. The other big piece of advice that I give people is don't rush, right? Do everything slowly. This isn't a speed. On the contrary, there's a lot of the things are timed where they say at least a certain amount of time, which means if you go too fast, you fail. So you can't fail for going too slow, but you can fail for going too fast. Does that make sense?
Yeah, that makes sense.
So like, for
Yeah.
example, washing hands, they like one of the steps is wash your, put your hands under the water for at least 20 seconds. You can be there for 30. You can be there for 35. You could be there for 4 minutes technically, because the rules say at least 20 seconds. But if you pull them out at 15 seconds, you fail. Does that make sense? So really take that deep breath, relax, don't panic, and don't rush, and just say, all right, and I'm just going to take my time, because the slower you go, you will fit within those time. The worst thing you can do is get really anxious, get really panicked, be like, okay, and then, all right, what's the next step? And then I'm going to move here and go this step and then go to this step here. And you didn't actually meet your time limit, right? You went too quickly. You didn't use enough time, and therefore you didn't pass that step. So take that deep breath, don't rush, and just go a little bit longer than what you feel, especially some of those ones that are 20 or 30 seconds. I mean, you have the second hand, so you could actually watch on the clock if you wanted to, but just take your time and just, just think, I got this. Yeah, I got this. I know what I'm doing. I've been practicing, and then move on to your next step. The other advice that I give people is go easy to difficult. Some people argue, no, start with the hard one first. I say go with the easy one and build your confidence. So when you actually take the skills test, I'd have to confirm with Benita, they choose, I think 5 of them, 5 out of the 25. But you don't know which 5. So you have to know all of them. But when you show up to the test itself, she will say, show me this, 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 and this. Then you get to choose the order. And so what I would say is start with the easy one. Start, when you hear the ones that you need to demonstrate and you're like, oh man, blood pressure, I hate this one. This one always gets me. Just do that one last. Do the one that you're confident in. You're like, oh, hand washing, I got hand washing. And then just like, all right, I'm going to start with hand washing and do that one first, the one you're comfortable with. Get it done, ace it, get it out of the way, and then move on to the next one. Move on to the
Basically,
next one.
hype yourself up.
Yes, exactly. Build that confidence. Because again, if you start with something difficult and make a mistake and you have to get it corrected and you realize you didn't pass it, then you're like, then that anxiety goes up, that stress goes up, you start to panic, and then you do worse on the other ones, right? So start easy, go difficult, and just keep on going. And like I said, keep in mind, they're not trying to fail you, right? They're really trying to help you pass. But this is so important because of these reasons, right? There is a standard and there's a reason why there's a standard. And we have to make sure that all CNAs meet that high bar of expectation, because you will be working with patients. You will be working with people in their lives, and we need to treat them with the respect and dignity that they deserve and the safety. And so making sure that all that is put into place. All right. Other advice, practice with dummies. So when you do the CNA test, you will often be doing a lot of these things with a dummy that's not a real person. And it can feel really awkward at first because you'll have to knock when you come in. You'll have to come in and introduce yourself and say, like, hi, my name is Sean Story. I am your CNA today. And it feels awkward talking to a dummy because it's not a real person. So get used to that. Practice as much as you can with the dummies. Practice with other people. Practice with stuffed animals. Practice at home talking to inanimate objects that aren't real people, because that's what you'll have to do on your practice skills test to pass the test. A lot of them is working with these dummies that aren't real, that aren't going to talk back. Get used to it, because it is a really weird feeling at first. Does that make sense?
Yep.
Are we good on that one? So definitely practice as much as you can. And again, the big thing is just follow the etiquette, right? Follow those steps. That manual will show you step 1, step 2, step 3, step 4, step 5, and show you the steps, bold what you have to do, and just follow it. And that's what you're being asked to do, is just follow the steps, do what you need to do, and go through it. So today and next week, we are going to look at these different skills here, and I have a video showing us how to do these skills to give you a better idea of how they work. Now, keeping in mind that these videos are not from Benita. Benita might have a little bit different way of doing certain things. She might have different, just because everyone's just a little bit different, right? Every instructor, every examiner is just a little bit different. And so you definitely want to know what she tells you to do. But this is, again, to kind of give you an overall idea of what it looks like, what the steps and procedures are, and what the language and vocabulary is like, and what you're going to be asked to do. So we're going to hopefully 1, 2, 3, 4, 5 get through the first 5 of them today, of hand washing, measuring weight. What does ambulate mean again?
Moving.
Moving. Yep. So it's like we're working with a patient that can or cannot move themselves. And so assisting with that moving, measuring blood pressure, and recording respiration. We've talked about these before, but we're going to take that deeper look in today. We talked about reading the weight, but we'll actually look at the steps of what you do to use that scale. So let's get started with hand washing. These are all links. And so you can go to the presentation slides, ladies, throughout the week and actually re-watch these to finish the assignments. And so those links will take you to this website here. And so who could read our introduction to hand washing for me?
I can.
Okay.
Hand washing is one very important aspect of CNA skills. That is, it helps in controlling and spreading any infection to the resident as well as the nurse aide. Below is the procedure of hand washing for CNA skills test. Before applying soap, you must get your hands and wrists wet and provide proper friction of at least 20 seconds. Clean your hands between fingers, nails, wrists, and cuticles. Separate them and rinse thoroughly. Turn off tap using a paper towel and discard the towel into a bin. Use another paper towel to dry your hands completely.
Mm-hmm. All right. So a few words, important things to know. Wrist as well. That when we're washing, you actually have to go all the way up to the wrist itself, right? And get that wrist wet and really wash from the wrist down. At least 20 seconds. So again, that's that part where you don't want to rush it, right? Because when you're being tested, when the pressure's on, the instructor's there with the clipboard, 20 seconds can feel like forever, right? I mean, 20 seconds can feel like minutes, but just take your time, right? And just really, because you have to scrub between the fingers, right? So you have to get between the fingers like this. You have to get your nail beds, which you take the palm of your hand with your nails and actually scrape it this way and scrape it that way. Wrists, and what are cuticles? Do we know cuticles? What that word means?
Yeah, it's the skin
said-
like the top of your finger.
Fingernails.
Yes, it's part of your fingernails. Yep, your cuticle is it's that part there. So with your fingernails. So again, it's that idea of you're really cleaning those fingernails, right? That getting those fingernails in the soap as well too. Rinse. And then the big thing here is that there are 2 separate towels, right? You have one towel for drying, and then you have another towel for turning off the water. So you I think in the video we're going to watch, she actually is going to dry her hands with the towel first, throw that towel away. It actually seems very, very wasteful. But then she takes another towel and dries her hands some more, throws it away. And then she takes another towel and then turns off the water and throws those away. I'm like, are you kidding me? But that is the procedure. So different towels for drying and turning off the faucet. Other things that we mentioned in the video that you'll see is like you can't touch the inside of the sink. You also cannot, you always have to keep your fingers pointing downward. You don't ever want to bring them upwards. It's always fingers pointing downward in the sink as you're turning and rotating in this way. And then the other thing she mentions too is you don't want to do the whole like, let me dry off my hands this way. Nope. Grab the towel, dry them off with a towel. All right. Any questions about these? Ready to watch the video?
Ready.
Let us watch. Right there.
Good afternoon. The first skill we will be going over today is hand washing. This will be the first skill that you are presented with when you take your test for this day. Now there are 10 steps to this particular skill. Anytime you see something in bold print, which if you look in your book, you will see.
That's the manual that she's holding, right? So every state has different manuals, and they also update them from year to year too. So you're gonna have to get the newest one from Bonita Banks that will be like, yep, this is what the Department of Health is using for this year for the CNAs. Here is the manual. That's also why I don't have one for you, is because they update them so often. I don't want to give you something that's out to date. So just on day one, ask for it from Bonita, and she will have the newest, most updated version for the state of Alaska for you to use and say, all right, these are the steps that you need to follow.
This is a critical element and you must do that particular step. In this instance, that would be number 5, which is lather all surfaces of wrists, hands, and fingers, producing friction for at least 20 seconds. I'll go over the steps. Number 1, address the client by name and introduce self to the client by name. This is a critical step simply because while you are doing all of your skills on this particular person, they need to know who you are. You need to identify yourself. You need to make sure you're doing the skill on the correct person. Turn on water at the sink. Wets hands and wrists thoroughly. Apply soap to hands. Lathers all surfaces of wrists, hands, and fingers, producing friction for at least 20 seconds. Cleans fingernails by rubbing fingertips across the palm of the opposite hand. After lathering for at least 20 seconds, rinses all surfaces of the wrists, hands, and fingers, keeping hands lower than the elbows and fingertips down. Uses clean, dry paper towel to dry all surfaces of hands, wrists, and fingers, then disposes of paper towel into the waste container. Use a clean, dry paper towel to turn off the faucets, then disposes of the paper towel in the waste container or uses a knee-foot control to turn off the faucet. Do not touch the inside of the sink at any time. Now, let me go ahead and demonstrate this skill. Good morning, Mrs. Smith. My name is Kim, and I'm going to be your CNA for the day. Before I begin, I'd like to go ahead and wash my hands, ma'am. Turning on the faucets with a paper towel is optional. You do not have to do that. If you so choose, you may. Make sure that you are getting the wrists as well as the hands wet. It's essential that the hands go in the water first. Next, get your Now, it is essential, as I said, that we wash the wrists, the hands. So please make sure you're washing the hands, you're keeping them facing down. Wash in between your fingertips. Okay. Then we want to go ahead and make sure that we're washing our fingernails. Okay. As I said previously, this should take at least 20 seconds. Now, I'm rinsing. Make sure you get all the bubbles, all the lather off of your hands without touching the inside of the sink. At this point in time, most people want to shake their fingers. Please do not. Get your paper toweling. Proceed to dry your hands off. Take a clean, dry paper towel and turn the faucets off. And that concludes.
All right, what did
hand
we see?
washing.
Besides a huge waste of paper towels, right? I was like, 4 of
She
them? I'm
did
like,
it.
are you
She did it step by step, like from entering the room of the resident, introducing herself, you know what she's gonna do. She's like procedure by procedure, I think.
Yep, exactly. And that's what the test is going to be like. And they're going to expect you to be able to do that, to walk in, knock the door, introduce yourself to the dummy, go in, and then wash your hands. Yep. Again, wrist is the important part. Wrist and down, always facing downward, going between the fingers, palm of the hands, at least 20 seconds. So don't rush it. Because like I said, that's the big one where it's that stress and anxiety and you're just like, oh, that was 20 seconds. But in actuality, it's only like 10 seconds, right? So just take your time. Take that deep breath, go around one more time, really lather those up, scrub, 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 scrub between the fingers, keeping them facing downward, and then rinsing them all off. All right, any questions about that, about hand washing? This one I feel we've been practicing a lot because like with the coronavirus pandemic and everything going on, hand washing was like the biggest advice that we were given as the best thing we could do is hand wash, hand wash, hand wash to stop the spread of disease. So huge important skill. Any questions about that?
Nothing from me.
Nope. All right. Let's move on to our next one. Our next one is measuring weight. And that'll be using the same type of scale that we were practicing last class. Let's watch how she does it. Who would like to read these steps for us? Measuring weight and recording weight procedure.
I can do it.
Hmm.
Measuring and recording weight is another important skill of a nursing assistant. In this post, we are going to show you the right procedure for this skill test. You must ensure that the weighing equipment is in proper working condition before starting the procedure. Set both the scales on 0 before you tell the client to stand on the weighing scale. Assist the patient to stand on the scale if necessary, and make sure that the client's feet are flat on the scale standing on it. Record the weight and note the difference from the last count. Ensure that the patient does not walk backwards, but forward to the bed.
Yeah. And so with this one here, because often the scales are facing the wall. And so what she does in the video here is actually have her like side step off of the scale and not step backwards, right? So it's like they're on the scale. And now to get off the scale, it's, oh, just step here off to the side. Now let's turn you around and then walk forward. They're trying to avoid stepping backward at all times. So it's always step off to the side, turn around, and then walk forward.
What's the reason for that?
I would say for falling, slipping and falling, right? Because when you're going backwards, more likely to bump into something you don't see, more likely to get caught off balance and to fall. Where if you're stepping off to the side, you're still within your peripheral vision. You can still see everything around you. If you're stepping backwards, there might be a chair or something that you don't actually see or are aware of. And so that's where having patients never step backwards is kind of one of their standards, is like, oh, step off to the side, turn around and walk forward. That would be my assumption. Asking Benita she would probably have a better answer for that, but I'm assuming that would be
Yes, yes,
the
yes,
idea of,
Fran.
yep, do
They're
you have,
they just preventing from falling.
yeah, just preventing from tripping, falling, and doing that, just trying to be as safe as possible with the clients. All right, any other questions? What does it mean to set the scale to 0? Think about our machine, right? All those pictures that we saw for last week. What do we do to set it to 0?
Move it all the way to the left.
Yeah. Because when it's at 0, the scale should be balanced because there's no weight on it. There's 0 weight. So at 0, it should be balanced. And so the moment you add weight, it'll go off balance and then you start moving it. She does something that I wouldn't have done. I didn't think of. I normally, when I'm taking someone's weight or like weighing myself, I mean, I know kind of where I'm at. I kind of just estimate, right? I'm just kind of like, are they, because the big question is, are they over 200 or under 200? If they're under 200, you start at 150. If they're over 200, you start at 200. Here, she actually says you keep going, that bottom one, until it goes down, then you go back and then move it over. You don't just assume thinking, oh, I think they're under 200. You just go until it goes down and then you come back and then you move the top one. So let's watch how she does it. I noticed the same procedures. She starts from the very beginning by introducing herself, introducing herself to the client, making sure that the patient is the right patient. Like, hey, you're Mrs. Jones, right? Mrs. Jones, I was told to take your weight today. Let's take your weight. Do you need any help? Can I help you up? And she does all of those customer service tasks to make the client feel as comfortable as possible. Let us watch.
The skill I am about to demonstrate is weighing the ambulatory client. Ambulatory, of course, meaning that the client is able to walk on their own. You are there only for assistive purposes if needed. I'll begin. Come in. Good morning, Miss Rice. The doctor has asked me to go ahead and obtain your weight. Is that okay with you? Yes, that's fine. Okay, let me make sure that your bed is locked, which it is. And if you can sit yourself on the side of your bed. Do you need me to help you? No, I'm fine. Okay. Oh, let's go ahead and make sure that you slip your feet into your shoes, your non-skid footwear. Okay. Can I assist you up? Okay, we're just going to walk over here to the scale, ma'am. Okay. One moment, please. Before you get on, I need to go ahead and zero out the scale. And I know that it's zeroed because the arrow here is right in the middle. Okay. Okay. If you'll go ahead and step onto the scale, ma'am. Okay. You have your balance? Yes. Okay. Now I'm going to begin by moving the lower. Okay. Now we will back up. Okay. Now we move it up. And it appears that we are in the middle. So if you would please, ma'am, step off the side here. Okay. Are you okay to go back to your room by yourself? Yes, I'm fine. Okay. Please be careful. And now I'm going to wash my hands before recording the weight. I will check the weight. And then if you will follow me, please. You will note that here we have 2. If you look at your bottom number, and then you come up top, and you add what you have. So here we have 200. Then we would add 1.5 pounds. I would record it under candidates, 01, and that could be 0.5 or 201 and a half. And that concludes the weight of the ambulatory client.
All right, what did we see?
We saw that she introduced herself again and made the patient feel comfortable before asking her to take her weight, and then asked if she could help the patient. Yeah.
She's like, do you need any help? Nope. All right, sounds good. What else did you see? What did she do before she had the patient get out of the bed?
She knocked on the bed and introduced herself.
And then after that, she checked something before she had her get out of bed.
She put slippers on her.
Oh, that was afterwards. There's something before. And this is a safety issue, and she did it for safety reasons. She checked something before she had her get out of the bed.
Oh, the wheels on the bed were locked.
Yes, the wheels on the bed were locked, right? So she made sure, she's like, oh, let me make sure that the bed is locked so that way it doesn't slip away or slide when they're trying to get out of the bed, right? So she made sure that the bed was locked and that it wasn't going to move before the client got out. And that's one of those, I'm not sure if that's specifically on the procedure, but that is one of those safety checks to be like, is the bed locked before I have them trying to get out? She also mentioned non-slip footwear, and so that's the thing too, making sure, especially in nursing homes. Maurice, maybe you have more to tell us about that. Are all of the clients at the nursing home required to have like special non-slip footwear?
Sometimes it depends on residents' what do you call that?
Preferences or?
Yeah, preferences. If they want to wear one, then they can. If some are, like some are the late stage of their dementias or Alzheimer's, late stage, and yeah, they're just out of there. So
yeah, and they're just then required to have the non-slip footwear. Absolutely. All right, any questions about measuring the weight and working with those scales?
Nothing from me.
Yep, I think the hardest part, I would say for me, would be not just going step by step by step for that bottom bar, because honestly, my reaction, if I would see her, I would have instantly just moved it straight to 200, right? I would have just went, well, I know she's over 200, right? So I would have went and just like moved it. But instead she was like, is it 50? No, not 50. Is it 100? And I'm like, come on, like, I'm like, come on, like seriously,
move
we
a
know.
little bit
But
faster.
I know, but that's part of the game, right? It is this idea of showing that you know the steps and procedures, that you can follow steps and procedures, because there is a reason why there has to be a standard, even though sometimes it seems kind of stupid and redundant. Like, do I seriously have to move step by step? That's the procedure, because that's what you're doing. You're demonstrating more that you have the ability to follow a procedure and to follow safety protocols. So just do it, because that's the procedure, right? That's part of the game of working with policy. It's policy, so we have to do it. So, all right, moving on. Next one is going to be ambulant patients. All right, and this is that idea of working with a gait belt. All right, who would like to read this one for us?
I can do it.
All right, go ahead.
Ambulation using a transfer gait belt. In this post, we are going to explain an important CNA skill, which is how to ambulation using a gait belt. Before starting the ambulating procedure, the CNA must explain all the procedures to the patient and clear any doubts they may have.
Mhm.
Position the gait belt before making the patient stand and snug it below the ribs. Ensure that the resident is at the comfort and there is no risk of any injury. Help the client to stand by holding the sides of the patient and ask him or her to stand with flat feet. Ask them if she is feeling dizzy before walking and carefully walking him or her up to the bed gently lower the patient onto the bed.
Awesome. All right. Any words, any questions any words or terms we don't understand?
Nope, but there's a little bit of misspelling.
Yes. And so ambulation is that idea of moving, right? That there is helping a patient move. All right, let's watch the video.
Good morning, everyone, and welcome to my Nurse Aid channel. So in this video, I'll be demonstrating to you the CNA testable skill, assist to ambulate using a transfer belt. There are 2 critical element steps in this skill. Step number 3, which requires you to ensure that the person is wearing non-skid footwear before standing. And step number 6, which requires the candidate to assist the person in a seated position with the person's feet flat on the floor. Your critical element steps are indicated in bold in your Nurse Aid Candidate Handbook. If you perform any of these critical element steps incorrectly, or if you omit these steps, you will automatically fail the skill. So you want to keep in mind to make sure you perform those steps correctly and you perform them, okay? So without further ado, let's go ahead and get started. Now, before I address the client, I want to make sure that I'm close to that person, so I don't start talking until I get right up on her. Good morning, Mrs. Carla. My name is Julie. I'm your CNA, and today I'll be assisting you with walking. Okay? First, I'm going to go ahead and do a quick safety check. I want to make sure your bed is in a low, safe position. Your bed wheels are locked. I'm going to go ahead and give you your call out just in case you need me for anything, okay? I'm going to provide you with privacy. And now I'm going to go wash my hands and gather my supplies, and I'll be right back, okay? The only supplies you'll need for this skill is going to be a gait belt or a transfer belt. Hi, Ms. Carla, it's Julie again. You're seeing. Okay, I have my supplies. First, what I'm going to do, I'm going to take your call light away, okay? And I'm going to uncover you. Now I'm going to assist you into a seated position, okay? I'm going to interlock my arm with your arm, and I'm going to put my other hand on the back of your shoulder, and on the count of 3, we're going to sit up, okay? 1, 2, 3. There we go. Good job. Now, while I have the candidate sitting, I'm going to make sure I close the back of her gown as much as possible. The reason being is the gait belt, it specifically says the gait belt is placed over the client's clothing or hospital gown, which means that the gait belt cannot be touching the resident's, or excuse me, the client's street clothes. If it is touching the person's street clothes, you will not get credit, so make sure you close that gown in the back as much as possible. Okay, Miss Carla, on the count of 3, I'm going to swivel you to the edge of the bed, okay? 1, 2, 3. And if you could, scooch up until your feet are flat on the floor. Okay. Now, when you have the person to scooch towards the edge of the bed, you want to make sure that you have your hand on that person, okay? All right, Miss Carla. I'll make sure that your gown is closed as much as possible in the back. And it is. Here are your shoes. Now, at this point, you want to initiate giving the resident his or her shoes, okay? You don't have to put them on, but you have to initiate. Do you need help putting your shoes on? No. Okay, go ahead and put those on for me. If the client initiates getting or putting on his or her shoes, you will not receive credit for this step. If you actually start putting on the client's shoes, the NAE or nurse aid examiner will have you, will tell the person to go ahead and put their own shoes on, okay? So remember, you have to initiate putting on the person's shoes. Okay, Ms. Carla, this is a gait belt. Some people call it a transfer belt. I'm gonna go ahead and put this on you, okay? If you could raise your arms for me. You want to make sure that when you're placing the gait belt, you're placing the belt teeth first, okay? And also, you do not want the buckle to be over the belly button, so you want it to be off to the side a little bit. It's going to be a little snug, okay? But it will loosen up as soon as you stand up. Okay. This excess, you can either leave hanging or you can tuck in, which I'm going to do. Now, before I stand Miss Carla up, I'm going to look again to make sure I have her gown closed as much as possible in the back, which I do. Okay. Now, Miss Carla, I'm going to go ahead and stabilize your legs, okay? It's going to be your leg, your leg, and my leg, okay? Now, you have to make sure that your knees are touching the client's knees. If they are not, you will not receive credit for this step. Okay, Ms. Carla, go ahead and put your hands here, and when I stand you, you can go ahead and push off with your hands, okay? We'll be standing on the count of 3. 1, 2, 3. Good job, okay? Now, if you could just pivot to your right. Now, when you're holding the gait belt, you want to make sure that your hands are cupped upwards, okay? Not down, but up, palms up. You can either hold the gait belt with one hand or with both hands, okay? And when walking, you want to be to the back and off to the side, okay? So you're not exactly at the side, and you're not completely behind her. You're behind and off to the side a little bit. Okay, Ms. Carla, we're going to take 10 steps forward and then 10 steps back, okay? You ready? Here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, and then go ahead and pivot to your right. There we go. And we're going to walk back to the bed, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, and go ahead and pivot. Here we go. And step back. Can you feel the bed behind you? Okay, on the count of 3, I'm going to go ahead and sit you, okay? 1, 2, 3. Awesome. And then at this time, you can go ahead and remove the gait belt. I'm going to go ahead and remove your gait belt now, okay? Now, at this point in time, you can either, depending on what skill you have next on your skill set, you can either have the person remain sitting or you can have them lie back down in bed. Would you like to stay seated or do you want to lie back down? Sitting. Okay. Here's your call light. Now, I'm going to go ahead and do a closing procedure also, which includes safety, okay? So you have your call light here in your hand. Your bed is still in a low safe position. Bed wheels are locked and privacy is maintained. At this point in time, you'll want to verbalize, "I'm washing my hands," skill complete.
All right. What did we see? What did we see, ladies?
She came in, introduced herself, made sure
Mhm.
the wheels were locked on the bed.
Mhm. It was also at a low, safe location. Mhm.
Made
She
sure
was
that
really
you had privacy.
Mhm. Yep, privacy, which is important. It was part of the closing too. Mhm.
she was really big into like the gown and it being closed and making sure that her street clothes weren't showing.
Yeah, and that's one of those things that could make you fail the test. That if the belt itself is touching their clothing and not the gown, that is that'll fail you, is what she said is one of the things. Mhm. What else was important? What was another one of those things that you could potentially fail if you didn't do right?
I think the turning process, like when they were going forward and then they were gonna go the other way, it was like a strict
Hmm.
directions.
Yeah. And she was also not standing directly behind or beside. It was kind of back and off to the side with the hand scooping upwards, not coming down, scooping upwards. All right, what else did we see? There was something about the shoes that was important.
I think she said about you need to initiate if she's gonna use the shoe, she's gonna put the shoes, or she's not gonna use the shoes, something like that.
Yes, and so the CNA has to initiate, which means say, you need to put on your shoes, do you need help, right? Like, do you want me to help you? But needs to verbally say, we need to put these shoes on, because those are the approved slip resistant shoes. Because this is a patient that struggles walking, that is a really high risk for falls. So they're at that stage where they have to, if they want to use them or not, it doesn't matter, they have to use them. So as the CNA, you're like, you need to put these on, do you need my help? But you can't just put them on without telling them. You literally have to initiate, you need to put these shoes on. It's kind of like a psychological thing of like, we do the same thing like working with young children too, where it's like, we need them to do something, but we basically tell them in a very nice way, like, you are going to do this, but you have a choice. You can do it or I can do it, but this is happening, period. And so that's kind of this idea of initiating. These shoes need to be worn. So I'm going to say, hey, you need to put on these shoes. Do you need my help putting these shoes on, or can you? And physically handing them to them. That's what it means by the CNA initiates the shoes. Does that make sense?
Yep.
Okay. All right, so I think we covered everything, and then like the hand washing. Now, and this is something you'd have to clear up with Benita too, with the hand washing, but with these tests, often the last step of all the procedures is wash your hands. But since you're doing a bunch of them during the test, she's not actually going to have you wash your hands every single time. She's just going to have you verbally tell her, I would then wash my hands right now. But you'd actually don't go through the entire hand washing procedure unless that is one of the skills you're being tested over. So you would just tell her, I would wash my hands, and now the test is over. Unless Benita wants to see you wash your hands, which then she would tell you. And so the best thing you can do is, like I said, just work with the instructor and the tester and just ask what they want. Really just kind of be as transparent as possible and just say, what are you looking for? Because they're not trying to trick you. They are trying to be upfront and honest, and really they're wanting you to be successful and pass. All right, any questions about moving a patient with a gait belt? The ambulation. Any questions?
Nothing for me.
All right. Do we have a question? We're good? Otherwise, we're now moving to measuring blood pressure. Let's look at this skill. All right. Measuring blood pressure. Who could read this procedure for us?
I'll read it.
All right, go ahead.
In this pose, we are going to explain an important CNA skill, which is measuring and recording blood pressure. Find the, what's this one?
Brachial The
Okay.
brachial. Brachial
Brachial
pulse.
pulse before you place the cuff on the arm, and once again before you place the stethoscope on the arm. While inflating the cuff, carefully listen to the heartbeat. The cuff inflation should be a maximum of 180. Hmm. How do I
HG.
read this? mmHg.
I would say HG.
Okay, Hg. Control the deflation of the cuff and accurately record the blood pressure. Make sure that you clean the equipment before storing it in the box.
Absolutely. All right. Any questions? Any words we don't know? All right. Hearing none, let's watch the video. All right. Measuring blood pressure.
The next skill that I will demonstrate is blood pressure. Now, as you are aware from the classroom, when you are testing, they will be using a teaching stethoscope, which has 2 sets of earpieces. You will have a set in your ears, and the evaluator will have a set in his or hers, so that they can listen with you. For demonstration purposes only, I will be using a single stethoscope today. But please do remember and note that when testing, you will be using a teaching stethoscope. I will begin with the procedure. Come in. Good afternoon, Miss Rice. The nurse has asked me to come in and take your vital signs, your blood pressure specifically. Is that okay?
Yes.
Okay, great. If you don't mind, ma'am, may I feel for your brachial artery? And I found that the easiest way is if I trace the middle finger up, veer slightly towards the pinky, and it's right there. Okay, once I find that pulse, I need to go ahead and place my blood pressure cuff approximately 3 finger widths above. I'm lining the artery line up where I first palpated your pulse. And I am securing the cuff around your arm. This is snug. Okay. I will now go ahead and wipe off both the diaphragm and the valve portion of my stethoscope, as well as the earpieces. And this is for infection control reasons. Okay. I will be placing the earpieces in my ears, and I will be inflating the cuff between 160 and 180, ma'am, and then I will slowly release. Are you ready?
Yes.
I've obtained your blood pressure. Allow me to take the cuff off. Here's your call light, ma'am, should you need me.
Okay.
Okay. I'm going to place the cuff and stethoscope in the designated dirty area. I will wash my hands, and then I will record your blood pressure. The evaluator will write her results under evaluator. You must be within 8 points of the evaluator in order to pass this skill, and that could be both systolic and diastolic. That concludes the blood pressure.
All right. Any questions, ladies? What did we see?
I just observe on every video that we watch. We're always, I mean, they're always asking for permission. Like, I'm gonna go and get your weight, ma'am. Is that okay? I'm gonna go and get your blood pressure. Is that okay? They're always, like asking for permission that you're gonna do something with the client or resident.
Yep. Absolutely.
What
And I see
happens
that
if they
too.
say no?
That is a great question. I was actually just thinking the same thing too. I was like, do you mind if I take your blood pressure? No. Well, then as a CNA, what I would say, that's a great question. I'd ask Benita, but what my gut instinct is then you just go and tell the nurse and just say, whoever told you to do it, you just say, okay, thank you, ma'am. Is it, yeah, if there's anything else I can get you, and then you just go and tell the nurse saying, hey, they don't want me to, the patient, he or she doesn't want me to do it for some reason. So.
Or this is other one, you just get out of the room and then come back a couple of minutes ago when she's calmed down, then you just come back. Yeah. Yep. Their mood swings are different in every minute. Every hour it's changing. So
yeah, especially working in a senior center when you're working with patients with dementia or Alzheimer's, just 4 or 5 minutes can be a huge change, like what Maurice is saying too. So yeah, just go and come back. But especially as a CNA, I would just say always refer to whoever's in charge, who's giving you your orders. Is it the nurse? Is it the RN? And just go back to that person saying, hey, I went in to take the blood pressure like you asked, and they're not wanting me to do it. Do you want to try? And normally the nurse will tell you what to do. It's like, hey, try again in 5 minutes, or whatever your supervisor tells you to do, just tell it to the supervisor. Yep. Any other questions? All right, so there's a few things to this skill here. There's actually the precepts and procedures that you need to know of how to do it, but then you also need to know the skill itself of how to bring it up to above 180, how to get to the point where you hear the heart rate, so then that's your top number, and then slowly releasing it, and you see it fluctuate every time there's a heart rate, and then when it stops doing it, then what your bottom number is. So getting those two, your top number and your bottom number, and practicing that skill and how to do that, but then also following the procedures. This one's a pretty tough one. And so, like I said, this is to kind of just give you a taste of what that skills test is like. Like I said, think of all of these procedures that you need to learn and know how to do. So it's a lot of information. The best thing you can do is just start from day one, right? Take 2 or 3 of them and practice over and over and over again, and then move on, practice over and over again, because this is the hardest part about finishing the CNA program. Sound good?